I am Jeff Martin. I'm a radiation oncologist here at Cape Cod Healthcare. A radiation oncologist works as part of a team. Usually we're using radiation to help treat cancer, and this can be in a variety of ways. It can be in the definitive setting where we are trying to cure the tumor. It can be in the post-operative setting where we're trying to help reduce the risk of the tumor from coming back. Or it can be in the palliative setting where we're trying to make someone feel better or trying to prevent a side effect from occurring. I chose radiation oncology after I had an experience following a radiation oncologist, and I was blown away by how much more time they got to spend with patients than any other field that I had seen prior. And the combination of that plus the interesting nature and the feeling like I was making a difference for cancer patients really is what made it feel like the only choice for me. We work together as a team. It's a lot of people that you may not necessarily see behind the scenes and that are helping to make sure your care is delivered in a safe and effective way, including our physicists and dosimetrists, which help with our treatment planning and making sure our machines are delivering the care in the radiation as we intend it to be delivered. And then there's the radiation therapists. These are the individuals that you will often interact with on a daily basis as they deliver and get you set up for your treatment every day. These people often become very close with their patients as they go through their care, from seeing them every day and helping them as they're navigating through this otherwise challenging time. And they can be a great support for patients. We also have our nurses in radiation oncology, which help to support and educate patients and help them navigate side effects they may experience as they're going through their treatment. We have social workers that help to support the patients from a variety of needs that might affect their ability to otherwise receive care. And we have our front desk staff, which provide a friendly face and a warm welcome as patients come into our department every day. It's most rewarding for me when I feel like I'm able to help someone feel better. And this can sometimes be physically, where I help to improve their pain or relieve a symptom. It can be emotionally, where we help them just to feel a little bit more certain, like they have a plan, that they know how to go about this. And sometimes it's even as they're having a difficult time and they realize their cancer may not be cured, and helping them to come to terms with the challenges that they're going to need to face. I came to Cape Cod because I really wanted the opportunity to take care of patients in a community setting, and I wanted to feel like I was helping all different patients within that setting. I really like that it's a small town feel here, and that you're able to help your neighbor or someone you might see in the supermarket or something like that. And it's been great to be a part of this community here. The main philosophy that I use to help me get through every day is really trying to treat everyone with kindness and empathy, and treating people as if they were a member of my family. I had many family members who have been affected by cancer, and it helps me to remember that everyone's coming into this with a different set of experiences and different background, and that, we need to be sensitive to that as they're coming in, and different people have different needs. And it's our job to help support them as they try to get through this often difficult and emotional time. I learned from my patients that everyone comes into this with a different set of experiences. Their prior experience with cancer, their family members' experience with cancer, and their own personal life experiences all impact what treatments they're willing to go through, and the kind of supports that they're going to need as they go through it. Sometimes that's a cheerleader, and sometimes that's someone to be a little more firm with them and help them figure out how to best navigate and get through their treatments. In my spare time, I like to play golf. It's a big hobby of mine. I also like to coach my son's Little League baseball team and spend time with my family.